Hey everyone, welcome back to all my listeners. This is episode 7 in season 18. Today is Wednesday, July 15th, 2026. My name is Sonal Patel, and this is the Paint the Medical Picture podcast series. Well, all right, you guys, I hope you are enjoying a lovely month of July so far. I know I am. It has been so toasty out here in the Midwest. We are soaring in the upper 90s as I'm recording this episode, and it is late in the evening already as I'm recording. So not sure when we're going to see any cooling temperatures. I know that showers and storms will pop up here over the weekend within the next few days. So I know we have that to look forward to, but I think we still have a lot more humidity left in store for the rest of the month. So, that's not that great on hair, not that good for skin. But of course, we have pools, we have beaches, we have lakes, we have all sorts of adventures right around the corner. So I know I'm looking forward to all of it. I hope you guys are doing the same in your summer, wherever you are located. So I just want to say welcome to a very hot summer. I know I'm very happy for it because in just a couple of weeks, things are going to shift quickly here. A couple of months, meaning like beginning of September, I know we will get the cold front. It normally comes. And then we have hot Indian summer in like October, November. So the weather out here is crazy. But I know I am enjoying my summer so far. Hope you guys had a very good 4th of July weekend. Bastille Day was just a couple days ago. Hope you celebrated that as well. I always used to have a great time celebrating with my girlfriends in New York City and Philadelphia and DC, wherever, for Bastille Day. It was always a great time, always having champagne. We always looked super cute with our French hats and striped shirts, whatever. Had a great time, but literally just thought about that the other day when a great girlfriend of mine texted that, happy Bastille Day, and we reminisced. So anyways, I hope you guys have celebrations like that throughout your lifetime that you can look back on, right? Reflect back on, and just remember the good old days of yesteryear. I just celebrated a birthday here at the end of June, so I'm always looking backwards. At this stage in midlife, I'm looking backwards, looking forwards, definitely for things like change. I have a really inspiring quote that I will touch on at the end of the episode in Spark. But, so when I'm looking forward for, my next endeavors, my next chapters, I'm always thinking about things like that in terms of change. And what I can do to help improve things, improve my life, improve my happiness, achieve my goals, etc. So anyways, you guys, I am digressing off into a rabbit hole at the beginning of the episode. That is rare from me. So let me get into what we're going to be talking about today. So it is the third week here in this large month of July, and I really wanted to focus on what just came out a few weeks ago, and that is, of course, our very important diagnosis codes. Every fall, I try and hit on the things that are new, but a few weeks ago, the CMS did release the new ICD10CM diagnosis codes and the coding guidelines that will take effect on October 1st, 2026 for fiscal year 2027. And of course, in my trusty tip, I want to go ahead and focus on compliance for how to better document and bill for hospital beds and hospital bed accessories. And then finally in Spark, I'm going to go ahead and close out and round out today's episode with a remarkable quote by Jim Rohn. All right, you guys, let's get into it. So today's Newsworthy. CMS has published the fiscal year 2027 ICD10CM code set on June 5th. And those updates include a whopping 190 new ICD-10 diagnosis codes. In addition, there are 30 deleted codes, as well as 4 revised codes. Now, these updates will become effective, again, only on October 1st, 2026, but the CMS is always rolling these ICD-10 updates out earlier than October because our hospital systems, organizations, and entities have to be well aware of these hundreds of new codes, in this case 190 to be exact, And they need to be able to implement them, upload them into the charge masters that all organizations have. And when I am auditing, going into practices from a compliance standpoint, a proactive standpoint, I always encourage providers, even if they are specialty unique, to be uploading all of the ICD-10 diagnosis codes that are new for that particular fiscal year, because you don't know what your patients are going to walk into the office with, right? In terms of diagnoses, what could be their problem. So we need to think a little bit broader than, I am just a quote unquote orthopedic surgeon, right? So I only need these orthopedic types of diagnoses, right? No, there could be greater problems, greater issues, and greater diagnoses that our providers will be faced with. So I always encourage them or someone on their team to upload all of the new ICD-10 codes that happen to be released. And like I said, for this year, it is 190 new codes. Now, the CDC released the ICD10CM guidelines on June 8th. These are downloadable zip files. They are located on both the CDC and the CMS websites. They house all of those new codes, the code addenda, as well as the code orders. So those files are really important for your teams to go ahead and download and then upload into the EMRs. All right, now of the 190 new codes, 33 are related to continuing pregnancy after vanishing twin syndrome. So that is our category O 31.4, and there are 17 codes that are related to toxic effect of cycloparaffins in our category T52.82. But I digress, right? I just wanted to give you a breadth of the variety of codes. I'm going to try and go section by section alphabetically. And those of you that are coding professionals, you are going to be well aware when you purchase the new ICD-10 code books as well. But for all of us, they are publicly available on the CMS website as well as the CDC website. And you just go ahead and download all of those zip files to make your life a lot easier. And then you can start understanding the greater meaning, the greater extensions that are available now for specificity for all of these codes. And as I looked over the 190 codes, I recognized that the majority of them have a lot of extensions out for specificity. And as I educate my providers, my practitioners, my practice managers, the C-suites, I'm always advising them that specificity is key, right? Especially ICD-11 is coming out. It will come out in the US. It's already available in many, many countries. We are behind the 8 ball once again, but as soon as they are released here in America, we will have to get very familiar with all of the new ICD-11 codes. But again, let's talk about what is going on today for the 190 new codes. So let's break it down. I tried to break it down by subsection, by subject, subcategory, titles. Of course, I reduced it for the brevity that the podcast allows, right? So some of the titles for the categories and chapters are much longer, but those of you that are coders in the audience, auditors, and compliance professionals, you will know what I am talking about. So let's go ahead and start with the first one, neoplasms. So there were 3 new codes that were added to the neoplasm section, and they are for secondary malignant neoplasms of the larynx, of the pharynx, and of the oral cavity. And they are C78.31, C78.32, and C79.83, respectively. Then we can move on and talk about diseases of the blood. There were two new codes that were added there, and they are for D69.11, which is for Glanzmann thrombocythemia, as well as D69.19 for other qualitative platelet defects. We can move on to the endocrine section of our ICD-10 book, which we will eventually receive when they are pushed out, right? But in these zip files, there are 2 new endocrine codes, and they are E89.830 for our post-bariatric hypoglycemia, And finally, for E89.838 for other post-procedural hypoglycemia. So very important codes for the family practice, internal medicine types of practices. This is a very, very good couple of codes to make sure that you are uploading. Now, one that I know I will see in my everyday work for auditing and billing and compliance work for the mental and behavioral health space. This is a new code, F64.A, and that is for gender identity disorder in remission. Now, we can move on to a couple of handfuls of new codes in the cardiology section of our ICD-10. Now, there is a code for I42.00, which is brand new, dilated cardiomyopathy unspecified. I42.01, familial genetic dilated cardiomyopathy. I42.09, other dilated cardiomyopathy. I42.81 for arrhythmogenic cardiomyopathy. Then there's I42.89 for other cardiomyopathies not elsewhere classified. Then there's also I47.22 for CPVT, which is for catecholinergic polymorphic ventricular tachycardia, or CPVT. I know I butchered that, but the acronym is CPVT. Moving on, there's I49.81, which is for Brugada syndrome. I49.82 for ventricular bigeminy. And finally, for I49.89, other specified cardiac arrhythmias not elsewhere classified. Then we can move on to the next section for odontogenic sinusitis. Now, there are a handful of codes there for J84.83, odontogenic sinusitis, J34.830 for odontogenic sinusitis maxillary sinus, J34.831 for odontogenic sinusitis ethmoid sinus, J34.832 for odontogenic sinusitis frontal sinus, J34.833 for odontogenic sinusitis sphenoid sinus, J34.839 for odontogenic sinusitis unspecified, and then for J4B for pulmonary mycetoma. So, as you can hear me talking, there are so many details for location, right? For the body location, right? So what part of the sinus is affected here for this particular ICD-10 code, right? So they were talking about the maxillary region, the ethmoid region, frontal, sphenoid. So really, really useful, important things for our ENT types of spaces, practices, and specialties. So lots of new things for the variety of audience members that I have. I think there's much, much more detail in these 190 codes that you can all review yourselves when you download this file. Now we can move on to diseases of the pelvis. There are a handful of codes here for K6A, diseases of the pelvis not elsewhere classified. K6A.0, pelvic abscess. K6A.01 for pre-vesical abscess. K68.09 for other pelvic abscess. K6A.8 for other diseases of the pelvis not elsewhere classified. K74.0A for hepatic fibrosis, moderate fibrosis. And then K76.83 for intestinal failure associated disease. Then we can move on to diseases of the skin. There's only one new code that was added, L02.237 for carbuncle of flank. Now, finally, there are a lot of new codes for the musculoskeletal system in the ICD-10 code range. There is M04.3 for Vexus syndrome. There's M67.A for plantar fasciitis. Now, there's a list of these for all of the different locations of plantar fasciitis for foot, right foot, left foot, unspecified foot. There's also M67.A for plantar fasciitis, M67.A0 for plantar fasciitis foot, M67.A01 for plantar fasciitis right foot, M67.A02 for plantar fasciitis left foot. There's M67.A09 for plantar fasciitis unspecified foot. There's also M72.20 for plantar fascial fibromatosis unspecified foot. There's also M72.21 for plantar fascial fibromatosis right foot. There's also M72.22 for plantar fascial fibromatosis left foot. And then there are tons of new and specific osteomyelitis codes under M86 with extensions for all of the other areas of the body that can be affected with osteomyelitis. I did not want to go over them. There are tons and tons. So please, if you are in the orthopedic space, this is going to be a really stellar banner year for you for fiscal year 2027, because there are a ton of new codes that your physicians and APPs have been demanding, right, for all of these years. There's so much more specificity. I love it. All right, so we can move on. There's also the new subcategory code of N99.86 for intraoperative and post-procedural complications and disorders of the breast. And there are two brand new codes that were added there, and they are N99.860 for intraoperative and post-procedural nipple ischemia. And finally, there is N99.861 for intraoperative and post-procedural nipple necrosis. We can move on to our pregnancy section. There are lots of new codes for ectopic pregnancies. Also a new category 031.4, which I highlighted earlier, for continuing pregnancy after vanishing twin syndrome of one fetus or more, includes new codes as well. Then we can move on to our congenital malformations. There is Q87.A for Louis-Dietz syndrome. There's also QA.171 for Lynch syndrome. There's also QA.1790 for familial cancer syndrome with pathogenic BRCA1 mutation. There's also QA1791 for familial cancer syndrome with pathogenic BRCA2 mutation. There's also QA.1792 for Lee-Fraumeni syndrome. And finally, there's QA.1798 for other inherited neoplasm predisposition syndrome of multiple systems. We can move on. There is one new code for the symptoms, signs, and abnormal findings section of ICD-10, and that is for R78.72 for abnormal gadolinium level in blood. And there are 4 deleted codes that are included for sternoclavicular sprains. Those are S23.420 for sprain of sternoclavicular joint ligament. That's been deleted. There is S23.420A for sprain of sternoclavicular joint ligament initial encounter. That was deleted. And then there's S23.420D for sprain of sternoclavicular joint ligament subsequent encounter. And finally, there's S23.420S for sprain for sternoclavicular joint ligament sequela. Finally, we can move on. There are so many toxic effects of alkenes. I don't want to get into all of them, but there are so many with extensions for accidental, unintentional, initial encounter, subsequent encounter, sequela. There's also toxic effect of alkenes for intentional self-harm with initial encounter, subsequent encounter, sequela. There's also the toxic effect of alkenes for assault that goes on through all the extensions for initial, subsequent, and sequela. And then there's also a section for those undetermined codes with extensions for initial encounter, subsequent encounter, and sequela. And finally, we can appreciate some of those new Z codes that were added for our body mass indexes. There is new code Z68.18 for our body mass index, or BMI, with a 18.4 or less adult. There's also Z68.19 for body mass index, or BMI, with a 18.5 through 19.9 for the adult. And then finally, for our suspected exposures and contact with section in ICD-10, there is Z77.013 for contact with and suspected exposure to gadolinium. There's also our Z77.32 with contact with and suspected exposure to burn pits in war theater. There's also Z77.33, contact with and suspected exposure to Agent Orange. There's also Z77.40, contact with and suspected exposure to unspecified blast overpressure. There's also Z77.41 for contact with and suspected exposure to low-level blast overpressure. There's also Z77.42 for contact with and suspected exposure to high-level blast overpressure. And then finally, there's Z77.49 for contact with and suspected exposure to blast overpressure. And then there's also one new code added for personal history in our ICD10CM. That is for Z86.17 for personal history of C. diff infection. And then there's a brand new bunch of codes for the gender identity and transitioning. Those are for our Z87.8901, personal history of social gender transition, Z87.8902 for personal history of medical gender transition. There's Z87.8903 for personal history of surgical gender transition. There is Z87.8904 for personal history of intersex surgery. There's also Z87.8909 for personal history of unspecified gender. And finally, there is Z87.893 for personal history of gender detransition. And now it's time for my best practice tips in Trusty Tip. So I wanted to go over some really helpful information from CMS when it comes to documentation compliance for hospital beds, as well as any accessories providers are billing for. So who is actually going to be affected? Well, those affected providers include physicians and our non-physician practitioners who write prescriptions or orders for hospital beds and hospital bed accessories. Now, the CMS talks about HCPCS codes and CPT codes and where those are found. And they're found in a wonderful LCD that is titled Hospital Beds and Accessories. And that LCD is titled L33820. So make sure you look that up as well, because it should be bookmarked if you happen to be a provider issuing these types of hospital beds and accessories. So they talk about a variety of groups of codes that are going to pertain to this particular Trusty Tip. So there is the group 1 of codes that include fixed height beds. And those fixed height beds are going to include 5 HCPCS codes. The first HCPCS code is E0250 for hospital bed fixed height with any type side rails with mattress. There's also HCPCS code E0251 for hospital bed fixed height with any type side rails without mattress. There's also E0290 for hospital bed fixed height without side rails with mattress. There's also E0291 for hospital bed fixed height without side rails without mattress. And finally, there is E0328 for hospital bed pediatric manual 360-degree side enclosures, top of headboard, footboard, and side rails up to 24 inches above the spring include mattress. Moving on, the LCD talks about the group 2 of codes, and there are 4 of those for the variable height beds. And that starts with our HCPCS code E0255, hospital bed, variable height, high-low, with any type side rails with mattress. E0256, hospital bed, variable height, high-low, with any type side rails without mattress. E0292, hospital bed, variable height, high-low, without side rails with mattress. And finally, E0293 for hospital bed, variable height, high-low, without side rails, without mattress. Moving on, the LCD goes into the group 3 of codes, and there are 5 codes there for semi-electric beds. Now, the first HCPCS code there is E0260 for hospital bed, semi-electric, head and foot adjustment with any type side rails with mattress. Then there's E0261 for hospital bed, semi-electric, head and foot adjustment with any type side rails without mattress. There's also E0294 for hospital bed, semi-electric, head and foot adjustment without side rails with mattress. E0295, hospital bed, semi-electric, head and foot adjustment without side rails without mattress. And finally, there's E0329 for hospital bed, pediatric, electric or semi-electric, 360-degree side enclosures, top of headboard, footboard, and side rails up to 24 inches above the spring, includes mattress. Then there's also our Group 4 set of codes for total electric beds in this LCD. Now, the first one is for E0265, hospital bed, total electric, head, foot, and height adjustments with any type side rails with mattress. E0266, hospital bed, total electric, head, foot, and height adjustments with any type side rails without mattress. E0296, hospital bed, total electric, head, foot, and height adjustments without side rails with mattress. E0297, hospital bed, total electric, head, foot, and height adjustments without side rails without mattress. And finally, we can move on to our Group 5 set of HCPCS codes for heavy-duty beds. Now, there is E0301 for hospital bed, heavy-duty, extra-wide, with weight capacity greater than 350 pounds, but less than or equal to 600 pounds, with any type side rails without mattress. Moving on, there's E0302 for hospital bed, extra heavy duty, extra wide, with weight capacity greater than 600 pounds, with any type side rails without mattress. There's also E0303 for hospital bed, heavy duty, extra wide, with weight capacity greater than 350 pounds, but less than or equal to 600 pounds, with any type side rails with mattress. And finally, there is E0304 for hospital bed, extra heavy duty, extra wide, with weight capacity greater than 600 pounds, with any type side rails with mattress. And then finally, there's our Group 6 of 13 HCPCS codes for the area of accessories. So for accessories, there is HCPCS code E0271, mattress, inner spring, E0272, mattress, foam, rubber, E0273 for bedboard, E0274 for overbed table, E0280 for bed cradle any type, E0305 for bed rails half length, E0310 for bed rails full length, E0315 for bed accessory board, table, or support device any type, E0316, safety enclosure frame canopy for use with hospital bed any type, E0910 for trapeze bars, aka patient helper, attached to the bed with grab bar, E0911 for trapeze bar, heavy duty for patient weight capacity greater than 250 pounds, attached to the bed with grab bar, E0912 for trapeze bar, heavy duty for patient weight capacity greater than 250 pounds, freestanding, complete with grab bar. And finally, E0940 for trapeze bar, freestanding, complete with grab bar. And then finally, there is for the Group 7 HCPCS code for the category of miscellaneous. There's only one HCPCS code, and that is for HCPCS code E1399 for durable medical equipment, miscellaneous. All right, now this particular CMS compliance tip talks about the background, right? Why was this discussed? It's because they put out a brand new 2024 Medicare fee for service supplemental improper payment data report, right? That's why they have released this information. It is to help us do better in our coding as well as our coordinating supplementation in the documentation, right? All of that has to go side by side swimmingly, those coordinating claims and the documentation. So, according to the 2024 Medicare Fee-for-Service Supplemental Improper Payment Data Report, the improper payment rate for hospital beds and accessories is a whopping 27.3%, with a projected improper payment amount of $16 million. Now, I audit these types of claims, these types of DME claims all the time, and I see providers getting the coding very, very wrong on those billed claims, especially for the pediatric space, especially for patients that are over that particular weight limit, right? There are codes that are more applicable, as you just heard me read to you, right, from the LCD. So we've got to do a better job and provide education to our practitioners in terms of coding and where they can find the appropriate codes. And it is in that LCD that I'm highlighting today. Now, it goes on and says that you must meet the provisions in the National Coverage Determination, or the NCD, for hospital beds in 280.7. And CMS outlines other policy requirements in the LCD L33820 that we're talking about today, right? There's also a coordinating article, a local coverage article, or LCA, for hospital beds and accessories, which is A52508. There's also another important DME LCA article that's always available, and that is for standard documentation requirements for all claims submitted to the DME MACs, and that is in A55426. Now, the CMS goes on and talks about denial reasons, right? That's what I want to always know, is what is missing. So, denial reasons. Insufficient documentation accounted for 82.6% of improper payments for hospital beds and accessories during the 2024 reporting period, while other errors counted in at 17.4%. And those also obviously caused improper payments. But again, it is that insufficient documentation that came in at a whopping 82.6%. Now, preventing denials, what can we do? There are those general coverage requirements that we should all be well aware of in this LCD. So let's just go over it. The CMS requires a practitioner to add documentation that the Medicare Administrative Contractor, the MAC, that their medical staff may consider necessary, including medical records and practitioners' reports that must prove the hospital bed's medical necessity because the patient's condition requires one of these things. Body positioning has to be documented. For example, to alleviate pain, promote good body alignment, prevent contractures, and avoid respiratory infections. Let's document that in ways that aren't workable in an ordinary bed. So we have to go deeper into the why. Why is this medically necessary for this particular patient? Also, special attachments are not fixable to or used on an ordinary bed. So all of these extra supplies and accessories can't just be affixed to your regular bed at home. It has to be attached, affixed to this particular hospital bed that we just went over. Now, the variable height feature, according to NCD 280.7, in well-documented cases, the MAC may find that a hospital bed's variable height feature is medically necessary. That feature is covered for one of these conditions: for severe arthritis and other injuries to lower extremities, for example, fractured hip. This condition requires the variable height feature to help the patient place their feet on the floor while sitting on the edge of the bed. Now, also for severe cardiac conditions, for those cardiac patients who can leave bed, but who must avoid the strain of jumping up or down. Also for patients that have spinal cord injuries, including in quadriplegic and paraplegic patients, multiple limb amputees, and stroke patients who can transfer from a bed to a wheelchair with or without help. And finally, for other severely debilitating diseases and conditions in which the patient requires the variable height feature to ambulate. Now, according to LCD L33820, CMS covers a variable height hospital bed that's in our HCPCS code E0255 or E0256 or E0292, as well as E0293, if the patient meets one of the criteria for a fixed height hospital bed and requires a bed height different from that of a fixed height hospital bed to transfer to a chair, a wheelchair, or to the standing position. Now, CMS also covers a fixed height hospital bed with our HCPCS code E0250, E0251, and E0290, E0291, and E0328 if the patient meets one or more of these criteria. If they have a medical condition that requires the body positioning in ways that can't be done with an ordinary bed, elevation of the head and upper body less than 30 degrees doesn't usually require a hospital bed, requires body positioning to alleviate pain in ways that can't be done with an ordinary bed, requires the head of the bed to be elevated more than 30 degrees most of the time due to a congestive heart failure, chronic pulmonary disease, or problems with aspiration. Also, if you require traction equipment that can be attached only to a hospital bed. Now, CMS also moves on and talks about semi-electric powered hospital bed adjustments. They may cover electric powered adjustments to lower and raise patients' head and foot when the MACs medical staff decide that number one, the patient's condition requires frequent change in body position, and number two, the patient may need an immediate change in body position. No delay is tolerable, and they can work the controls and make the adjustments. Now, the CMS may make exceptions to this last requirement in cases of spinal cord injuries and brain injured patients. Now, they will cover a semi-electric hospital bed with HCPCS codes E0260, E0261, E0294, E0295, and E0329 if the patient meets one of the criteria for a fixed height bed and requires frequent changes in body position or has an immediate need for a change in body position. Now, CMS does not cover a total electric hospital bed with HCPCS codes E0265, E0266, E0296, and E0297 because the height adjustment feature is a convenience feature, so they deny them as not medically reasonable and not medically necessary. Now, the CMS does cover a heavy-duty, extra-wide hospital bed with HCPCS code E0301 and E0303 if the patient meets one of the criteria for a fixed height hospital bed and their weight is more than 350 pounds but does not exceed 600 pounds. Now, CMS covers any extra heavy-duty hospital bed with our HCPCS code E0302 and E0304 if the patient meets one of the criteria for the hospital bed and their weight is more than 600 pounds. Now, for any of these hospital beds, plus those billed with HCPCS code E1399, if the documentation does not justify the medical need of the type of bed that you build, the CMS will deny payment as not reasonable and not necessary. Now, they divulge some of the general documentation requirements, right? And this is the part that I stress to my providers all the time. It's a two-way street. That LCD as well as that DME LCD have to be addressed. They may even throw in the LCA, which they do for this particular code set as well, right? So you've got to look at all three, the LCD, the DME LCD, as well as the LCA, as they are all applicable here. So in order to justify payment for the DME POS items, suppliers must meet the following requirements. The standard written order, I know I've talked about that in the podcast for years, the medical record information, including the continued need or use, if that's applicable, correct coding, as well as the proof of delivery. All of those things must be retained in documentation. And of course, please look to the LCA as well in A52508, because that provides much more detail on how to bill for hospital beds with the accessories, which ones are considered column 1 and column 2 codes when billed together, as well as what modifiers may need to be on billed claims. And finally, in this week's inspiring quote in Spark, it's inspiration from Jim Rohn. Your life does not get better by chance. It gets better by change. So very true, right? I love this quote on change. Life gets better with every new face that we see, every chance encounter. We do not know what's around the corner if we sit too comfortably. This quote inspires to take a chance on change and make life sweeter. I'm happy Jim Rohn's spark burns brightly and can still inspire so very many. All right, you guys. Well, that wraps up today's episode. My goodness, this was a longer episode than I expected, but so much fantastic information. I know I have my ICD-10 codes ready to go for a variety of my practitioners who are roaring to go. They are ready to upload things into their charge masters. They are ready. So I look forward to helping them much sooner than in years past. So I'm very, very happy that I have a lot of proactive practitioners under my belt this year in 2026. It's just a wonderful thing when they take that initiative towards compliance, right? Anytime in the year. So right now it's the start of the third quarter, right? It's Q3 already. And, they are ready to embrace it. So I love it. I'll take it. I'll take the win at any month of the year. Proactive compliance is the way to go. So I hope you guys got a lot out of the segment on the new fiscal year 2027 ICD-10 codes. Definitely go ahead and download those zip files. They are available to you publicly. You don't need to wait until those ICD-10 code books come out. So get ahead of things because October 1st is around the corner. And then I really hope you guys got a lot out of basically most of the DME POS stuff that I've been talking about for years, right? In terms of lack of coding chops and lack of documentation. So this particular segment in Trusty Tip was all about hospital beds and those accessories. And I've seen many a thing go sideways in the things that I've audited in this past year. Anyways, you guys, I hope you have a lot of good things, fun things in store this particular weekend. I know I have some presentations I've got to beef up over the next few months. So I'll be busy working this weekend and next weekend as well, I think. So not much fun for me, but a lot of stuff I have to button up for my speaking engagements that I have coming up here around the corner. So anyways, you guys, I wish you all an amazing and very, very happy week ahead. Thank you so much for listening on today's episode. And I hope every week with me brings you closer to helping your providers paint a masterpiece. See you next Wednesday.